Hello, 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 and welcome back to the podcast. So we skipped a couple weeks ago to take some time off for Thanksgiving, but last week we had Jake Greenspan on the podcast, and I hope you enjoyed that episode. And the next two episodes, we are going to focus on math. And my guest today is Monica Grillo. She has extensive experience in research-based math interventions and instructional practices. She's an educator, a researcher, a mother with an extreme bias toward inclusive practices and a need for better teacher preparation in special education and mathematics pedagogical content knowledge, PCK. Her experiences have opened her eyes to inequities, and she is here and eager to share her expertise and insights in order to make this world a better place. I'm so happy that she's here to have this conversation with me about dyscalculia, aka math disorder.
Millions of kids struggle with learning, processing, and social emotional difficulties. These challenges interfere with their ability to reach their full potential. Dr. Karen Wilson is here to help. Her extensive background in pediatric neuropsychology and higher education have prepared her for this unique mission. Listen as she delivers content to inform, educate, and empower parents and educators. This will enable you to identify challenges that kids face and get them on the road to achieving their full potential. This is Diverse Thinking, Different Learning by Child Nexus.
Monica Grillo, welcome to the podcast.
Thank you. Thanks so much for having me.
I am so happy that you're here because I'm really excited about this topic that we're going to cover today. But I kind of want to start to learn a little bit about you because we're going to be talking about math. And in the intro, I talked about the fact that we are going to be talking about math and math disorders today. But I'd love to hear about you and how you came to study math and math disorders.
Sure. So my undergraduate degree is in elementary education, but I went ahead and got an endorsement in middle school math. I think initially it was because I liked math, but also a little bit of job security, right? So middle school math is such a high need area. But I think I originally saw myself teaching younger elementary school. And then, of course, once you have that middle school math endorsement, that's where you get hired. So I spent my first 3 years teaching middle school math, 7th grade, 8th grade, and Algebra 1, and really fell in love with curriculum and content and just the art and science of teaching. So I went and got my master's degree in curriculum and instruction and ended up with a K-8 math specialist certification and completely fell head over heels in my first job out of grad school with coaching teachers. I loved working as an interventionist with the students, but the other half of my job was really helping teachers plan lessons, make sure their instruction was aligned and sound and engaging. And I really fell in love with that part. And after about 5 years there, my husband and I got pregnant with our first child and found out he was going to have Down syndrome and congenital heart disease. And so I had to leave the classroom so that I, wasn't writing plans from the ICU while he was having his heart surgeries. But I really kind of took an interest in special education in a way that I hadn't before. And he's 5.5 now. And so I've spent the last 5 years learning, more about special education than a general education teacher would be prepared for. And decided to get my PhD in special education and disability policy. So I'm in my second year of that. And just really appreciate now learning about math from the general education approach and math from the special education approach, because there are some differences in schools of thought. And I think I have this really beautiful and unique position to sort of bridge them.
You absolutely do. I mean, I think your background and your experience perfectly, prepares you to enter this field and to do great things. I'm so glad that you've chosen this route because, we see so many kids who struggle with math, and it's one of those things with, unlike dyslexia or ADHD, where you hear lots and lots about, even autism spectrum disorder, you don't hear a lot about math disorders. And oftentimes and I've said this before on the podcast, that, when kids are not good at reading or they struggle with reading, we don't say, well, I'm just not a reader. I'm just not good at reading. But we do that with math. I'm just not good at math, or I'm not a math person. Have you come across that
those are the most foul words you can say as a parent, in my humble opinion.
Yes.
You said we would never say that about reading, but
Yes.
That's sort of, to kind of preview the end. That's one of my closing remarks is just, please don't let that be okay in your house. Even if you aren't good at math or you're afraid of math, please just tell your kids they can do it and that it will be a challenge and things are challenging in life and they can do it and we will. And it's important, right? Use those phrases like you would with reading, but about math.
Right. And some kids do have a significant difficulty with math. There's a specific learning disorder in math. And, we use the term dyscalculia. Can you tell us what that is for listeners or parents who may not know what that is, for educators who may not have a good understanding of what that means? Can you tell us what that is?
Sure. So, broad strokes, it is this common agreed upon impairment in math skills. And it's generally not able to be explained by either an intelligence deficit or some sort of inadequacy in the learning environment, right? It affects about 3 to 7 or 8% of the school age population. And it does not affect males or females at substantially different rates. The other thing we know about dyscalculia is that it has a high likelihood of existing with other developmental or mental disorders, such as you've mentioned dyslexia, but it can also exist with attention deficit, hyperactivity disorder, or anxiety, depression, even some aggression disorders. The thing that I think is really interesting about dyscalculia is that there isn't like one test, right? Like there isn't a gold standard test for dyscalculia. And so a lot of variety exists within that named population. So different groups of kids are identified based on the structure of the test that's used. So within dyscalculia, there's just this wide variety of different impairments and different cognitive skills. And really the only sort of delineation or benchmark we have is really from like the clinical side of things, right? So like if you were to go to a psychiatrist to get a diagnosis for a mathematic learning disability, they would probably use that, diagnostic and statistical manual and they would look for symptoms, right? And those symptoms would need to be pervasive for 6 months, and you would have to be trying things and trying to fix it and get better math scores or math knowledge for at least 6 months with no improvement. So even though clinically, we recognize that the cutoff score for any test is somewhat arbitrary, right? Because there isn't that gold standard. Clinically, the American Psychiatric Association definitely recommends that any test you are using, the student should be substantially below normal, right? Mm-hmm. So it shouldn't just be like a small deficit in math. There needs to be a substantial deficit in any standardized test that you use. And it should be pervasive for a good 6 months without anything really working to fix it.
Okay. And that's a really good description for parents who may not understand exactly what a math disorder is or what dyscalculia is, which is a math disorder. And knowing that it is pervasive, it is a child who's performing far below expected levels or below expected levels in math relative to other cognitive abilities, even other academic areas. So what does the science tell us about dyscalculia? In terms of, because oftentimes, you'll hear, well, is that a real thing? Right?
Right. So if it's okay if I nerd out for a minute about
Please do. Yes.
Okay. All right. So there is substantial neurobiological evidence that developmental dyscalculia is a brain-based disorder. And that's just with a giant period at the end of that statement. It exists. And how they tell this in neuroscience is really taking a look at images of the brain. And they show in students who have dyscalculia versus those who do not, a real reduction in actual gray matter and white matter volumes. They also show a decreased brain activation in those regions of the brain that are related to number processing or spatial ability, even working memory or attention. And the gray matter really has to do with sort of is there a signal in the brain, right? Is there a signal that we should be passing on throughout the brain? And so reduced gray matter really has to do with like understanding, is there something happening here? Whereas the white matter is sort of almost like your highway in the brain, right? Like it is this giant connective conduit. And it says like information in the brain can go from this place all the way over here, right? And so when you have reduced gray and white matter, it's not just is there a signal? It's the sort of the speed and strength of that signal when you're doing these math problems. And so in pop science, generally, like your general population will be aware that like a reduced matter in the brain contributes to a reduced cognitive functioning in some degree, right? What I think is interesting is just last year, there was a study that was published in Frontiers in Human Neuroscience. And what it showed is that for the first time, children with developmental dyscalculia have a persistently reduced gray and white matter. So it's not just at one time. It's actually, they did a longitudinal study and showed that from childhood through adolescence, where there should be a ton of change in your volume of gray and white matter, they actually showed persistent structural differences in children who were dyscalculic. And what that tells us is that this is an actual persistent learning disorder. It has deficits in number processing and deficits in gray and white matter volume in those number-related brain areas. And then the third thing I wanted to share is just, you mentioned dyslexia. And one of the things that the science tells us, again, fairly recently, is that the brains of children who have dyscalculia, who have dyslexia, and who have both dyscalculia and dyslexia, at the neural level, they actually function very similarly, like more similarly than we thought. And the brains of those three groups of students who have those learning disabilities, they look very different from children who don't have them. There's a lot less activation in those like frontal areas of the brain. And again, just that reduced matter in the brain as well. So that's interesting that even children with what we thought was a reading disability and a math disability, their brains look similar.
Right. And that's really good. I love that you're emphasizing the brain base for this disorder, because that really helps explain that this is not about a child's motivation or disliking math. And when they're struggling in math to a significant degree below what we would expect, and you've tried other things to help improve math skills, that this is really because that child's brain is organized and wired differently. You talked about the gray matter, you talked about the white matter, and I think that helps us to see that this is really a brain-based struggle that needs to be thought of in that way. And when we think about it in that way, then it seems like we're more willing to give children the support that they need in order to address the issue.
And the right support, because we can give children support and motivation, but if that doesn't seem to be the issue,
it's not going to change their brain wiring.
Right, exactly.
Yes. And I love that you talked about the overlap between dyslexia and dyscalculia, because I see that a lot. And oftentimes the emphasis is on the treatment for the dyslexia, because we know so much more about dyslexia than we know about dyscalculia. And when kids struggle with math, I'm thinking about math word problems. How do you distinguish between a language-based issue versus math? Because you talked about understanding numbers, right? But I see a lot of kids who struggle with math word problems. And you also talked about the connection between dyslexia, which is a language-based disorder, and math. If you have both, are you at a greater likelihood of having difficulty with math word problems as opposed to math calculations? Or can you talk about that relationship a little bit?
Sure. So as we discussed, the science says that children with dyscalculia and dyslexia, they have substantial neural similarity at the brain level. But as we know in practice, in real life, they manifest differently through, one way you can tell is like error analysis, right? So my favorite method for error analysis, like trying to analyze where the problem is listening to a child do a think aloud as they solve a word problem.
Oh, interesting.
Right. So I think aloud is challenging for a student and the assessor to kind of get into the rhythm of it. But essentially what you do is you say, as you're solving this word problem, like as soon as I say start until you put your pencil down, you're done. I want you to say out loud everything that's happening in your brain. Like, I don't just want you to read the problem to me. I want you to tell me how you're thinking about it, why you're thinking about it. If you have thoughts of like, I don't want to do this anymore, like just tell me everything that happens in your brain. And so as we know, to get the right answer to a word problem, kids have to be able to read the words. They have to be able to figure out what math operation to use. And then they have to actually do the calculations correctly. And so that first step is very closely tied to language. Can they read the word problem? And that third step is very closely tied to math. So can they do the calculations? But that middle step is a very beautiful combination of both, right? So if I have 17 more than Sally, I have to actually be able to read the word 17 more than Sally. But I also have to know, what does that mean in terms of computation, right? What does that mean in terms of number? And a breakdown in any of these skills can cause trouble. I probably make it sound simpler than it is, but obviously do this for a living. But for parents and new teachers, it takes practice. But I would really encourage you to ask your child or your students to talk through one-on-one to really assess and pinpoint where that struggle is. Are they really tripping over words? Are they able to explain what the word problem means to them? Are they struggling with the math? And really doing that error analysis is helpful.
That's wonderful. And I think that talking aloud, I can see how you can identify again where the breakdown is. And that's so important because that determines where the intervention is, right? Is it a language-based issue where it's receptive language, so you have to target their receptive language system through language therapy? Or is it really in those calculations at that calculation step? Or is it both, right? Which means they would need the support for both of those things. Now, students differ from each other in terms of where they struggle in math. You can have two students with dyscalculia, but they can struggle with different aspects of math. And you talked about, in your teaching experience, there's algebra, there's calculus, there's geometry. For younger kids, there's basic math calculations, and some kids don't have any difficulty with addition and subtraction, but then they get to multiplication and things fall apart. Do you see that with dyscalculia, that students struggle with different aspects of math?
Yes, definitely. And I think it's important to understand that there are a wide variety of skills that can fall under that umbrella of dyscalculia in terms of number and quantity. And even as young as the preschool years, really just even what we call number magnitude or numerical magnitude processing. It's as basic as understanding when you envision that number 6 in your mind and you're drawing it, knowing that represents 6 items in a set. That as early as preschool, right? That can be something that is a red flag for dyscalculia if students are struggling even with understanding that. And we usually assess if they're understanding that through what we call a numerical comparison task. So we might give them a card that has 6 dots on it, and then we might give them a card that has 18 dots on it. And we might say quickly, without counting, which one is numerically larger. And most children can kind of say the 18 is there's more dots, right? But when students, even in the preschool years, are struggling with that kind of concept, it can be an early indication of future struggles with math. And similarly, once they're familiar with their actual numerals, if you show them maybe in kindergarten a card that has a 9 and a card that has a 2, and they're unable to choose which one is numerically larger, that can also then kind of be a second red flag. But as you can imagine, if you struggle with those things, then counting is going to be challenging. Finding a number on a number line is going to be challenging. And even things that you think are 4th grade concepts are actually 1st grade concepts, like understanding the place value system, right? So if you want a child in second grade to do 17 plus 14, but they don't understand that the actual number 17 is not just a 1 and a 7. It's 7 more than 10. And that's why the 1 is where it is and the 7 is where it is. Like all those kinds of things are really sort of secretly acquired as you're going through these early years. And that can affect your retrieval of math facts. I mean, can you imagine if someone needs to calculate 8 times 4 every time it's presented to them, right?
Right.
That means that when they hit 4th grade and they're doing long division or multi-digit multiplication, that means 431 times 57, which 4th graders should be able to do by hand at the end of the year. That means these students are calculating each of those facts as they do that problem on the side. And that just makes that so much more error prone or a struggle. And again, that's where some of those anxieties and depression and even aggression start to kind of come out of like, this is hard. It's not going well for me, you know?
Right. Absolutely. And I think about those errors that they make, even if when they know what to do and because, they have to break down the task in a different way and they make that small error with math, everything is wrong. You make that small error in one step of a 3-step process and the whole problem is wrong. And I can see how that can, contribute to that frustration and that anxiety for kids who then end up just saying, I'm not good at math. Right. Yeah. We talk a lot about, the need for explicit instruction in reading. Is that also true for math? And what does that look like?
Yes, so it does exist. And it is somewhat similar. I think, the content is obviously different, but your broad overarching concept is the same. So explicit instruction in math can be provided to a large group of students, like a whole class, or even a small group at a small table, or even one-on-one individual students. And basically what you're thinking of when you think of explicit instruction is kind of setting the stage with context. So why are we learning what we're learning? Kind of providing what we call an advanced organizer to help the student really get context for what's about to happen. And then in explicit instruction in math, we do modeling. So we will, there's not a set number. Research generally uses 2 or 3 problems, but we model for the students how to do a problem that they have just been provided the advanced organizer for. And this is a teacher basically doing a physical demonstration along with a verbal explanation. So think about that think aloud we talked about with the students. The teacher is going to be doing that during the modeling phase. And then they'll move into guided practice, which is the student taking the reins based on those modelings and the teacher being right there to provide prompts if there's a mistake. If there's a failure to do the next step, if they're not sure what to do next, the teacher's right there to provide those prompts. And then also the teacher needs to be cognizant in explicit instruction during this phase to provide feedback on not just is it right or wrong, but also the strategy that they're using. So if a student is not successful during this guided portion, meaning the teacher has to really provide a lot of prompts, it's very normal to go back to that modeling phase. And that's where the teacher will just, again, go through several problems, showing them step by step what to do. And then students in explicit instruction, the final step is to engage in an independent practice. And that's where the student completes several problems independently. But the helpful thing is the teacher can check these for monitoring, right? Are the students understanding what I showed them, what we've practiced? Are they able to do it by themselves? And the nice thing about explicit instruction in math is that it can be paired with other evidence-based practices. So concrete representational abstract, schema-based instruction, or even a task analysis, like a checklist for solving problems. Those are other evidence-based practices in math instruction for students with disabilities that can be paired with explicit instruction and done in that manner.
Mm-hmm. So it sounds like there's different tools to represent math concepts and procedures. And, you described kind of a teacher going through this with kids. And it seems like all kids, regardless of whether or not they struggle with math, would benefit from that explicit instruction. And is the process different for kids with dyscalculia in terms of how to support them? What does the research tell us about treatment for dyscalculia?
So multiple representations are not different in terms of how you would present them for students with dyscalculia. Explicit instruction is not necessarily the general education approach. And that's where those two competing schools of thought are. So sometimes we call the general education approach inquiry-based, and it allows students to really struggle with sort of the problem-solving process and wonder about things. It often involves trial and error. And those are things that if your brain is wired differently, it may not be the best way to help those neural pathways get established. Really, that explicit instruction has been found to be more effective with students with disabilities than with general education students.
Wonderful. And that's good for parents to know that when their child is struggling, kind of what to ask for in terms of support, that it's really, again, you talk about an evidence-based approach to addressing the dyscalculia. It's not just meeting with, a high school student to go over your math homework is not going to address the underlying difficulty with math, which is sometimes what is prescribed in quotes.
Right. Go get a tutor.
Right. Exactly. But what you're describing is really, again, an evidence-based approach to addressing the dyscalculia. And that's really targeting those brain regions that you talked about and the efficiency with which they're processing that information. Now, one of the reasons why I want to have you on the podcast, Monica, is that you and I both believe that there's a need for more inclusive practices and a better need for teacher preparation in special education math. And you are, the poster person for this. I'd love for you to talk about that because I think that there's just so much misunderstanding about learning disorders in general, but math in particular. What are your thoughts on this? We probably need another 30 minutes.
We probably do. I'll try to get it in very quickly and succinctly. So I think what's important for parents and our teachers who are listening to know is that this is a highly relevant concept, right? Like math is a significant component of the knowledge required in our technological age. We used to just talk about math with like recipes, right? In the kitchen. But we literally develop computer programs with the knowledge we have based on mathematics. And so numerical cognition and disabilities in numerical cognition, they're a hugely important scientific field for solving society's problems, right? You think about the computer programs that have been developed that have actually furthered our society. It's a hugely important and relevant area. And what we need to know about special educator preparation and teacher preparation in general is that in order for these inclusive instructional partnerships to be effective, special educators need to be able to kind of move in and out of the lead role of teaching. And in order to do that, you think of any teacher, you think of helping your students with their homework, right? You need to know the content. You need to be very familiar with the content. And that leads to confidence with the content. It helps when you're teaching to be able to just select appropriate examples with teaching. It'll help the students comprehend the concept better. It'll help them connect it to their daily lives if their teacher is confident with the content. And it also helps the teacher, especially the special educators, anticipate and identify sort of where in that lesson students will struggle or get confused. And so right now in our teacher preparation programs for special education, it's not a federal mandate that teachers have a math class if they're going to be a special education teacher. And if they do, there's a lot of teacher preparation programs that have adopted a math methods class for their special educators. They have one. And these special educators can be certified K-12. So you think about the expertise level. That means instead of having your student pulled out of the room to get their math instruction from a special educator who may have had one class on math and how to teach it, you really want your student to stay in the general education classroom with the general education math teacher who probably has a math degree or at least a degree in how to teach math. If the special educator is in there, that intervention approach can be done within the classroom where the content has a much greater chance of being sound, where the teacher is highly familiar with it and confident with it. And that really, it leads to more success for our students with disabilities in their mathematics achievement.
And that makes perfect sense. And then you also, address that kind of that social and emotional aspect of a child who struggles with a learning disorder being pulled out of class, for that individualized instruction. And if it can be integrated into their general education curriculum, and obviously it's not, doesn't work for all students because there may be complex issues, but for that student who's really struggling with math and who could benefit from that approach and stay in the classroom with their peers, that would be ideal.
I agree.
So, Monica, any final tips for educators and parents regarding what to do when they see a child who's struggling in math? What do you recommend for steps when they see that struggle with math in particular?
Sure. So the first thing is don't wait. So even preschool children who are possibly at risk for developing dyscalculia should receive treatment and supportive treatment as early as possible. Again, just to recap a couple things, when dyscalculia is not recognized, there's going to be those negative school experiences that start to happen. And those can also be another tell for parents, because that repeated lack of success with math generates fear of failure, as well as low self-esteem. If you're seeing things like anxiety, depression, or aggressiveness, I would sort of dig into that, right? And see, is there a content at school that's really causing those moods? Also, for parents, advocate for that very specific intervention, because if a evidence-based intervention is not done and dyscalculia is not identified, oftentimes it does lead to scholastic failure and even chronic absenteeism, right? That avoidance of school. I don't want to be there. That treatment that you advocate for should be specific to dyscalculia, initiated as early as possible, and as we just talked about, should be provided by a trained expert in a setting that is conducive to your students' learning environment. If they have comorbid or coexisting ADHD, that needs to be taken into consideration. And the final tip I have for parents is please, 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 please don't pass on your social anxiety, social acceptability of math phobia and math anxiety to your kids. Because just like we say with reading, math is so important. You need to know math in order to be a contributing member of society and be successful. And you can do it. And tell your children that too.
I love that. I think those are great tips for educators and parents. And just want to thank you so much for being on the podcast, because this is really important information that I want to make sure gets out into the hands of parents and educators and anyone who works with children and adolescents. If people have more questions about dyscalculia, what is the best way for them to get in touch with you?
Sure. So my email would probably be easiest. Would you like me to share it here, or do you have it on your site?
I will actually put it in the show notes, so they will have it. So again, thank you so much for being here and for sharing such important information today.
You're welcome. Thanks for having me.
If you are not taking notes during this episode, I suggest that you grab a pen, a piece of paper, and go back to the beginning of this episode, listen to it again, and jot down all the amazing nuggets of information that Monica Grillo shared during this episode. I would love to stay in touch with you. Go on the childnexus.com website and sign up for our news blasts. You will get information about resources related to kids who learn and think differently. Thanks so much for listening.
Thanks for listening to Diverse Thinking, Different Learning by Child Nexus. For more resources, visit us online at childnexus.com.